we are going to talk about causes of cough. So anything that causes irritation of the respiratory system can cause cough, like inhalation of fumes, smoke, dust for example, or aspiration of foreign body, of gastric contents like injured, or of upper airway secretions, what we call postnasal drip. Postnasal drip can happen in common cold, in sinusitis and rhinitis, whether allergic, vasomotor, or post-infectious. Infections also can cause cough. Upper respiratory tract infections like common cold, sinusitis, pharyngitis, laryngitis, or lower respiratory tract infections like bronchitis, pneumonia, lung abscess, or TB. Airway diseases like asthma, COPD, bronchiectasis also cause cough. Tumors like bronchogenic carcinoma, laryngeal carcinoma, carcinoid tumor. Compression from outside the respiratory system, like, for example, enlarged lymph nodes, aortic aneurysm, mediastinal tumor, neck and upper airway masses. Parenchymal lung diseases can cause cough. And parenchymal lung diseases are interstitial lung diseases and pulmonary edema. Interstitial lung diseases are granulomatous, like sarcoidosis, can be part of connective tissue diseases and collagen vascular disease, like rheumatoid arthritis, systemic lupus erythematosus, and systemic sclerosis. Also, pulmonary fibrosis is part of interstitial lung disease, like cryptogenic fibrosing alveolitis, extrinsic allergic alveolitis. And occupational lung diseases like asbestosis and coal worker pneumoconiosis can all cause cough. Pulmonary edema, and the main cause of it is congestive heart failure, and can also be caused by causes like damaged heart valves or inhalation of toxins. Other causes of cough are psychogenic, drugs like ACE inhibitors, auditory canal stimulation, neuromuscular diseases like Parkinson, pulmonary embolism, and pleural effusion. So this is a general look at the causes of cough.